Hey gentlemen, welcome back to Dental Miracle. If you or someone you love has survived cancer, you know that the battle does not end when treatment stops. Many cancer survivors face ongoing challenges, and dental problems are among the most common and distressing. But here is the incredible news. Tooth regeneration therapy, particularly Japan's groundbreaking TRGO35 treatment, might offer new hope specifically tailored for cancer survivors. Today, we are diving deep into tooth regeneration for cancer survivors, the special considerations, the challenges, the timeline, and most importantly, the hope on the horizon. Before we begin, if you are new here, welcome. We cover the latest breakthroughs in regenerative dentistry. Hit that subscribe button and ring the bell so you do not miss any updates on this revolutionary field. Let's get started. First, let's talk about why this matters so much for cancer survivors. Cancer treatment, whether it is chemotherapy, radiation therapy, or stem cell transplants, can absolutely devastate your oral health. And I want to be clear, this is not your fault. These treatments save lives, but they come with consequences. Here are the main dental problems cancer survivors face. Radiation to the head and neck can permanently damage salivary glands, leading to chronic dry mouth. Without saliva, your teeth lose their natural protection, leading to rapid decay and tooth loss. Chemotherapy can weaken tooth enamel, cause gum disease, and in some cases, actually kill the stem cells in your jaw that would normally help maintain healthy teeth. Bisphosphonates and other bone-strengthening drugs used during cancer treatment can cause a condition called osteonecrosis of the jaw, making traditional dental implants extremely risky or impossible. According to research published in the Journal of Clinical Oncology, up to 40% of head and neck cancer survivors experience severe tooth loss within 5 years of completing radiation therapy. For many survivors, losing teeth feels like losing another piece of themselves after already giving so much to beat cancer. And traditional solutions like dental implants often are not safe options because of radiation damage to the jawbone. This is exactly where tooth regeneration therapy could be like. Before we talk about special considerations for cancer survivors, let's quickly review how this therapy works. Japan's TRGO35, developed by Dr. Katsu Takahashi and his team at Kyoto University, is a monoclonal antibody that blocks a protein called usag1. Now, here is the fascinating part. Humans actually have the genetic blueprint for THREE sets of teeth. Not just if we grow our baby teeth, then our adult teeth, but that third set, it stays dormant because usag1 actively suppresses it. TRGO35 essentially turns off usag1, allowing those dormant tooth buds to activate and grow into fully functional teeth. The treatment is given as an injection near the site where you have lost teeth. The clinical trials in Japan have shown remarkable success in growing new teeth in adults who lost teeth due to congenital conditions. But here is the critical question. Will this work for cancer survivors whose oral environment has been compromised by treatment? This is where things get more complex, but also where the research is really exciting. First consideration: radiation damage to the jaw. If you have had radiation therapy to your head or neck, your jawbone has likely experienced what doctors call radiation osteonecrosis, or at least significant damage to blood vessels in the bone. The good news: tooth regeneration therapy does not require drilling into the bone like traditional implants do. It works by stimulating your body's own biological processes. Early research suggests that because TRGO35 uses growth factors and your body's natural mechanisms, it may actually help heal some of that radiation damage while growing new teeth. A 2024 study from Osaka University, and I will link this in the description, showed that growth factors similar to those activated by TRGO35 actually improved bone density in irradiated jaw tissue in animal models. Second consideration: timing after cancer treatment. This is crucial. Cancer survivors cannot start tooth regeneration therapy immediately after treatment ends. Based on current guidelines being developed, you will likely need to be at least 2 to 3 years cancer-free, cleared by your oncologist, have stable oral health with no active infections, off any medications that suppress bone growth. The reason for this waiting period is twofold. First, Your body needs time to heal from cancer treatment. Second, researchers want to ensure the therapy does not interfere with any lingering cancer cells or affect your cancer surveillance. Third consideration, immune system status. TRGO35 is a biological therapy that works with your immune system. If your immune system was compromised by chemotherapy, or if you are taking immunosuppressant drugs, the timing and dosage may need adjustment. The good news is that the clinical trials in Japan are actively including participants with various medical histories, and they are collecting data specifically on immune-compromised patients. Fourth consideration, medication interruptions. If you are taking bisphosphonates or denosumab for bone health, common after certain cancers, traditional dental implants are very risky. However, early evidence suggests tooth regeneration therapy may actually work better in these patients because these medications increase bone density. This is one area where cancer survivors might actually have an advantage. Let's talk about the realistic timeline. Phase 3 clinical trials for TRGO35 are happening right now in Japan and are expected to conclude in late 2026 or early 2027. Initial approval in Japan is anticipated for 2027 to 2028. But this first approval will likely be for specific conditions, probably congenital tooth absence first. Expanded approval for tooth loss due to other causes, including radiation therapy and cancer treatment, will probably come 1 to 2 years later, around 2029 to 2030. Now, here is something important. There is talk of compassionate use programs. These special programs allow patients with severe medical needs to access experimental treatments before full approval. Cancer survivors with severe tooth loss and no other safe options could potentially qualify for compassionate use as early as 2027 in Japan, and possibly 2028 to 2029 in other countries. If you are interested in this route, I recommend speaking with your oncologist about clinical trials, contacting major cancer centers that participate in international research, registering with organizations that track regenerative medicine trials. I will put links in the description to help you get started while we wait for this therapy to become available. There are things cancer survivors can do right now to preserve their oral health and prepare for tooth regeneration. Number 1, protect remaining teeth aggressively. Use prescription strength fluoride toothpaste, consider hydroxyapida toothpaste, and maintain meticulous oral hygiene. Every tooth you save now is one less you need to regrow later. Number 2, manage dry mouth. If radiation damaged your salivary glands, use saliva substitutes, drink lots of water, and consider medications like pilocarpine or Sevomline to stimulate remaining salivary function. Number 3, build bone density. If your oncologist approves, consider vitamin D3 supplementation. Most cancer survivors are deficient. Vitamin K2-4 directing calcium to bones, weight-bearing exercise, adequate protein intake, strong jawbone will make tooth regeneration more successful when it becomes available. Number 4, stay connected to research. Join cancer survivor support groups that discuss dental issues. Many major cancer centers are tracking dental complications and may offer early access to new therapies. Number 5, document your dental history. Keep detailed records of your cancer treatment, radiation doses to the jaw, and dental problems that developed afterward. This documentation will be crucial if you apply for early access programs. Look, I know this journey has been incredibly difficult. Cancer survivors have already been through so much, and dealing with tooth loss on top of everything else can feel overwhelming. But I want you to hear this. Tooth regeneration therapy is not science fiction anymore. It is happening. Real patients in Japan are growing real teeth right now as part of these clinical trials. And the researchers are specifically thinking about you, about cancer survivors, about people with compromised oral health, about those who have been told dental implants are not safe for them. You have not been forgotten. The timeline might feel long, but we are talking about just 3 to 5 years before this could be accessible to cancer survivors in many parts of the world. That is not that far away. In the meantime, protect your oral health, stay informed, and hold on to hope. If you found this video helpful, please give it a thumbs up and share it with anyone in your life who has navigated cancer and is dealing with dental issues. Your story and your challenges matter, and the more we talk about this, the more pressure there is to make these treatments accessible quickly. Do not forget to subscribe to Dental Miracle for updates on tooth regeneration research. We will be following these clinical trials closely and bringing you news as it develops. Drop a comment below. Are you a cancer survivor dealing with dental problems? What questions do you have about tooth regeneration therapy? I read every comment, and your input helps shape future videos. Remember, your smile is not gone forever. The future of dentistry is being written right now, and it includes you. I will see you in the next video. Take care. Thanks for watching, guys, and I'll see you in the next video.